now we guide. No limit for we see how we they fly. Make me sunny, they bonfire. But we dreams them higher and higher. From mass come to business line. Every student na star go shine. Oh, we no go tire, we go carry on. From morning class till the break of dawn. We voice loud, put up on the screen. Online TV, make them see we clean. Yeah. Unimac to the world down. One line TV, now we voice, now we story, oh. Robert, you too good, Unimac, to the shine, oh. From make me down, to the rise, oh. One line TV, make we show. Salon youth, make we blow now. Unimac, we the glow. Knowledge power, make we grow. One line TV, no go down low. We not the future, make them know. From lecture hall to the street side, we the hustle, we the push pride. Book now we weapon, brain now we guide. No limit for we see how we they fly. Make me sunny, they bonfire. But we dreams them higher and higher. From mass come to business line. Every student na star go shine. Oh, we no go tire, we go carry on. From morning class till the break of dawn. We voice loud, put up on the screen. One line TV, make them see we clean. Yeah. Unimac to the world down. One line TV, now we voice, now we story, oh. Robert, you too good, Unimac, to the shine, oh. From make me down, to the rise, oh. One line TV, make we show. Salon youth, make we blow now. Unimac, we the glow. Knowledge power, make we grow. One line TV, no go down low. We not the future, make them know. From lecture hall to the street side, we the hustle, we the push pride. Book now we weapon, brain now we guide. No limit for we see how we they fly. Make me sunny, they bonfire. But we dreams them higher and higher. From mass come to business line. Every student na star go shine. Oh, we no go tire, we go carry on. From morning class till the break of dawn. We voice loud, put up on the screen. One line TV, make them see we clean. Yeah. Unimac to the world down. One line TV, now we voice, now we story, oh. Robert, you too good, Salon youth, make we blow now. Unimaka, we the glow. Knowledge power, make we grow. Online TV, no go down low. We not the future, make them know. From lecture hall to the street side, we the hustle, we the push pride. Book now we weapon, brain now we guide. No limit for we see how we they fly. Make me sunny, they bonfire. But we dreams them higher and higher. From mass come to business line. Every student na star go shine. Oh, we no go tire, we go carry on. From morning class till the break of dawn. We voice loud, put them on the screen. Online TV, make them see we clean. Yeah. Unimac to the world down. One line TV, now we voice, now we story, oh. Robert, you too good, Unimac, with the shine, oh. From make me down, to the rise, oh. One line TV, make we show. Salon youth, make we blow now. Unimaka, we the glow. Knowledge power, make we grow. Online TV, no go down low. We not the future, make them know. From lecture hall to the street side, we the hustle, we the push pride. Book now we weapon, brain now we guide. No limit for we see how we they fly. Make me sunny, they bonfire. But we dreams them higher and higher. From mass come to business line. Every student na star go shine. Oh, we no go tire, we go carry on. From morning class till the break of dawn. We voice loud, put them on the screen. Online TV, make them see we clean. Yeah. Unimac to the world down. One line TV, now we voice, now we story, oh. Robert, you too good, Unimac, with the shine, oh. From make me down, to the rise, oh. One line TV, make we show. Salon youth, make we blow now. Unimaka, we the glow. Knowledge power, make we grow. Online TV, no go down low. We not the future, make them know. From lecture hall to the street side, we the hustle, we the push pride. Book now we weapon, brain now we guide. No limit for we see how we they fly. Make me sunny, they bonfire. But we dreams them higher and higher. From mass come to business line. Every student na star go shine. Oh, we no go tire, we go carry on. From morning class till the break of dawn. We voice loud, put them on the screen. Online TV, make them see we clean. Yeah. Unimac to the world, oh. One line TV, how we voice, how we story, oh. Robert, you too good, Unimac, with the shine, oh. From make me down, with the rise, oh. One line TV, make we show up. Salon youth, make we blow now. Unimac, with the glow. Knowledge power, make we grow. One line TV, no go down low. We not the future, make them know. From lecture hall to the street side, we dey hustle, we dey push pride. Book now we weapon, brain now we guide. No limit for we, see how we dey fly. Make me sunny, they bonfire, but we dreams them higher and higher. From mass come to business line, every student na star go shine. Oh, we no go tire, we go carry on. From morning class till the break of dawn, we voice loud, put on the screen. One line TV, make them see we clean. Yeah. Unimac to the world, oh. One line TV, how we voice, how we story, oh. Robert, you too good, Unimac, with the shine, oh. From make me down, with the rise, oh. One line TV, make we show. Salon youth, make we blow now. Unimac, with the glow. Knowledge power, make we grow. One line TV, no go down low. We not the future, make them know. From lecture hall to the street side, we dey hustle, we dey push pride. Book now we weapon, brain now we guide. No limit for we, see how we dey fly. Make me sunny, they bonfire, but we dreams them higher and higher. From mass come to business line, every student na star go shine. Oh, we no go tire, we go carry on. From morning class till the break of dawn, we voice loud, put on the screen. One line TV, make them see we clean. Yeah. Unimac to the world, oh. One line TV, how we voice, how we story, oh. Robert, you too good, Unimac, with the shine, oh. From make me down, with the rise, oh. One line TV, make we show. Salon youth, make we blow now. Unimac, with the glow. Knowledge power, make we grow. One line TV, no go down low. We not the future, make them know. From lecture hall to the street side, we dey hustle, we dey push pride. Book now we weapon, brain now we guide. No limit for we, see how we dey fly. Make me sunny, bonfire, but we dreams them higher and higher. From mass come to business line, every student na star go shine. Oh, we no go tire, we go carry on. From morning class till the break of dawn, we voice loud, put am on the screen. One line TV, make them see we clean.
Hi, and welcome to another edition of the Unimark Good Evening Show. This is the Unimark Live, where they broadcast from Fatima Campus Studio. And me, now I'm a presenter, Mabinti Samuaba. And this evening, we there with a guest, we can tell you about the public symposium, screening, and treatment for students in the Uni campus. However, we will give him a chance for making introduce himself to you. Good evening and welcome, sir.
Good evening, and thank you for getting me now. Me na Dr. Yaya Sembu Conte, a medical officer na the Makeni Regional Hospital, HF Wellness Clinic.
You were able to tell me what's the meaning of that HF?
HF means AIDS Healthcare Foundation, Sierra Leone. This is an international global health organization. We done the operate in Sierra Leone since 2012. They partner with the government of Sierra Leone through the Ministry of Health for support HIV response and STI testing treatment, and also they have government for provide other sexual and reproductive health services in Sierra Leone.
So what's in this symposium, this screening and treatment at Uni campus about?
Yes, so like I don't tell you, AHF na an international global health organization. We believe for promote the health of communities, and so a little over a month ago, we get the opportunity for collaborate with the Unimark, the University of Makeni Public Health Society. We do an assessment and find out, say, there is the strong need for where we engage the student community, especially in Ayoni, for enhance the health knowledge, the awareness around the health seeking behavior, waiting some of the sick them where young people are vulnerable of, and now for protect themselves, but also for even conduct testing and possibly treat.
So what's it being about this partnership between UNA and Public Health Society together?
Yes, well, this is not something we always don't do, because we believe say now the health sector partnership is something very, very important, because one person not able to do all by himself. So for we promote the health of communities, of individuals, we believe in partnership. So like I will tell you, AHF is a public health organization, and we get the University of Makeni. We also they provide public health courses. So that one they automatically establish some commonalities and between what the AHF stand for and the public health, Unimark Public Health Society. So that they be able for help where we get this partnership. They reach out that they want for organize a health symposium for students, them for raise the awareness around the common diseases they get, then common STIs, even for increase student the health seeking behavior, for do tests, for know their status, how for prevent themselves, because these are young people who are sexually active, and sometimes things and the way people then can do now because they not get the awareness. So they reach out to we and we see say waiting they want for do it align with waiting we stand for as an organization for promote the health of individual communities and even the population as a whole. So that one day the really make we get further conversation and bring about the partnership and yes we get the health symposium where we engage students them the Uni campus.
So we believe to reduce the cost across. We want to know which one is really make an adjust the campus and
Well, this now based on the assessment we the public health society make. And you know anything where you can start, you get to start small. We know the University of McKinney get other campuses there. But based on the assessment where we do and we work with the public health society, we get to decide say, let we start first na the Uni campus. You know, um, this na young people, they're vulnerable, they need health knowledge. Yes, so now on that basis, they we say, let we start for because we just get to start somewhere, and from there, we they look forward to continuous collaboration. We will say, let we also do the Fatima campus, and even for work with other um, education institutions within McKinney.
so we can believe for now student in my campus was encouraging and just any maybe approximate number one and people ready for you just
Yes, so I can tell you authoritatively that the turnout be encouraging, the massive. Of course, when we start first, because students then be also they engage on classes. But by the time we get to 11, 12, because we start around 11:30. Yes, but by the time we dey get to 12, then we see influx of students. Then we come and joined the symposium, and we discuss a wide range of health issues. Then ranging from sexually transmitted infection. We do a presentation and we talk about within the mean, how person can get there, how for prevent, treatment and all them things. And then we also talk about even hypertension, how, within hypertension, we talk about diabetes, We also talk about things around substance abuse. And we know in recent times, the issue about substance abuse, like contemporary issues. In fact, as a country, we even the president declare them as a state of health emergency, and these are young people, and we know the connection between when somebody they under the influence of something, it can easily involve in irresponsible sex activity, and that one they can expose that person there for contract a sexually transmitted infection. So we also discuss then things then the sexually transmitted infection, hepatitis, diabetes, hypertension, substance abuse, and we get a lot of questions. There will be get a Q&A sessions as well.
so with all of these sicknesses proven a lot, what if una be diagnosed person and una find out maybe STIs and other diseases waiting now plan for them?
Yeah, so the whole program now be a 2 days program. The first day now be the 29th May. We'll be get the health symposium. We do presentations. We project pictures of different STIs. Because like you say, seeing is believing, so that people then go also able to appreciate waiting we dey talk about. If we talk about gonorrhea, we talk about syphilis, chlamydia, etc., etc. Let them also see with the eye how that one they can look like. So we do that them presentations then they and we get questions them. So the whole day we've been just really dedicated to the symposium. And the following day when I started, now day we get the health screening, we screen close to 100, students them we avail themselves voluntarily and we do them, we check their weights, we measure their BP, we do tests for them, for STIs, syphilis, HIV, and the one them where we get need for teeth, we treat, we provide medication because now that's what they do as a hospital, as an organization, AHF, where they at the McKinney General Hospital, they provide free services them. So we dey test and if there's indication we diagnose any health condition, we also dey treat that person there at no cost. However, there are other services them where we not be able to provide na the campus day, because of the environment not conducive. But we also ask students then for can at the hospital, at the McKinsey Hospital, for example, like cervical cancer screening, because a service where we dey provide for screen woman them for cervical cancer. We get other tests where we dey do, for example, we get a machine at the hospital when hygiene expert machine. They do PCR testing for gonorrhea and chlamydia. That one day na test where they take time and need for the in a lab, like control environment. So we're not able to have it. The one day where we see need, we talk to them confidentially because that is very, very critical. We service what they provide, they highly confidential. Because all too often, I they can make people they can just shy away because of the stigma, anytime we talk when they talk about sex, it becomes a taboo, the cultural, implication. People don't want to talk about them. So we services are highly confidential. So the one they want to provide services and folks say, okay, when I can at the hospital, we follow up with them and then they come and we provide services then for them.
So for the one that you go to, is it that they get any financial obligations for their this and also sustainable this thing because for sickness, for cancer, STIs, also 1 week something these are ongoing something with the ultimate. So how sustainable then treatments they are?
Yes, so as far as the AHF Wellness Clinic in McKinney concerned, last year around June, we start this STI clinic, and the services that we dey provide na few, mainly we dey target, for example, syphilis, gonorrhea, chlamydia, the other bacteria, vaginosis, and na few, yeah, and the only thing we just need letting services then the people then come for the services then. But in terms of sustainability, it is something we are open to sustain as long as they need it. People then they come. We see a lot of young people they come and they access the services. It means the service is needed and everything we get for do with STI is free. We dey do the test and we provide the treatment. It's free. And we dey do follow up. We dey do what we call contact TSA because some people then they way you treat, you need for follow up how then they do. The symptoms we then carry, for example, if in a discharge, then they discharge, vaginal discharge, we want to know if they don't subside. So we can also get returning patients the way they can come. Whether then still they get the symptoms then so that we will know the next line of action or then we can much better. We just can't do a follow up because that one is very important. We start for treat somebody, they go want for do a follow up, and you get some other treatments then until they go till like then 3 weeks, for example, syphilis. So we can treat every week we dey give a person injection every week. So it will take that kind of period almost 3 weeks. But the majority of the client that we see, so they put on treatment for 2 weeks, when they come out, the symptoms then can all resolve. you know. And part of what again we can do, we can always they remind people them where they access the service, the clients them, for also do what we call partner notification, because we they do what we call partner treatment. Because then sit down they talk about mainly then they get transferred from one person to the other through sexual intercourse. And also often if we just get one person, one client to come, we treat them, they feel better. But if in partner not come, for we also treat them, we then go back and get sexual intercourse. They also call it infection. So these are some of the strategies there. And when you come to the cancer side, the aim now for let we pick up any abnormality now the woman in the productive part, especially also called the cervix, because I mean one side now one organ that one day we can develop cancer. And so the idea now for let we pick up any abnormality and we do what we call thermal ablation when a cervical cancer screening and preventive therapy or treatment. Because when we do that thermal ablation, if we see like say, this changes all this is so if we left this woman so until the next 5 years or so, it will develop cervical cancer. So we will treat her and then it no go develop the cancer because we know for treat the cancer later it's more expensive than for prevent her now. So it's not just about the treatment, as a clinic or as a hospital and organization, as a healthcare foundation, but we also get a strong preventive drive. We do community engagement, we do sensitization, let people they know how to prevent. Because if you get the whole population don't get infected, well, of course the resources not go there for treat everybody. So as we treat, we they also promote preventive strategies so that one person nobody can repeatedly with reinfection because the cost for treating that person as much as it's free then it becomes expensive.
So let's say person gets they listen to it and then get this say una they provide free treatment to them. And maybe the person not from uni or maybe not even student. So how accessible the clinic can be to those people?
Yeah, that's now a salient question that one day. The clinic, the McKinney General Hospital, Makama, and as you enter at the gate, you just ask for the AHF Wellness Clinic. It is very close to the treatment center. We get another building there outside we can treat people there, especially where we can get an outbreak there. Like they told began pox, so now they treat patients there, we isolate them and treat them. So the building they're very close to that other building there. So it's very accessible. It's very accessible. You just go at the McKinney General Hospital and you ask, they ask for the HF Wellness Clinic. They're between the mortuary and the treatment center. And in terms of the targeted population, regardless whether student in a Yoni or in a McKinney and a Fatima Institute, or even we get calls them from outside McKinney because we also get, the Facebook page, we get a clinic number where people then can even call and book appointments, say we they come or we get so issue, So they target young people. We know young people are sexually active. And as long as you're sexually active, you they at risk for get STI. So we target young people. We also they reach out to commercial sex workers. We don't they do outreaches. They meet them, decide and they care for providing services. And because these are people we also they at risk. We don't they provide services then for the correctional center. We know these are people then we enclosed, but as much as then they another side they try to go through the justice system, but at the same time health issues is a human rights issue. They still need to get access to quality health care. So we also then they go inside the prisons and providing services and they don't provide services for even the disabled because this is what AHS stands for and that the Ministry of Health stand for let everybody, regardless of your status, your vulnerability, for let you get access to quality healthcare services. So we dey target them different people there, yeah. Even the persons in uniform, like the military, the police, and even the prisons officers, we don't they provide services for all the people in there. Yes, and for the hospital, we did it from Mondays to Friday, and the clinic is easily accessible.
So with Uni campus then outreach and other sectors the way una don visit so far, wetin una challenges dey una face as a clinic?
Yes, so for the challenges, except for the fact say we dey move, but each time we dey move, we dey prepare. We know this is an outreach where we dey go, and now because we don't identify barriers then. For example, we don't go now one camp. I don't know if it's an amputee camp, so I get disabled. And some man go tell you say, we not able to come at the hospital because you know the transport. You know, not the transport here for camp. Some man go tell you because of the physically challenged. You know, of course, possibly in a prison, you're not supposed to come out because you they under restriction and the law they look after you. Yes, but we were able for the engage because in all then institutions that you therefore engage force. Probably you engage on a right because they also get for ensure say then inmates here then secured. So if somebody they come out there are procedures, you know. But we not go see that one there as too much of a challenge because those are procedural issues. But just ensure say okay, everybody is safe. But otherwise, I don't think say there is too much of a challenge where we dey go. We dey get for provide services. I think the only thing sometimes now for able forget them people then do for come now the hospital and get the service and then get some of them barriers and the more easy way make from time to time we can go out for the outreaches there so that we'll take the services then and then doorstep.
So in the area of confidentiality, una no can get any challenge there because there are people where they go afraid say they no go see the sick pamages no. I turn out forget STIs. How una cable like for talk to them people then they for them for trust una with the medical issues then.
Yeah, that's very critical. So we get the expertise. We are trained healthcare professional and counseling a form a critical component of the services that we provide. And I make even before we dey do the test, we dey explain to the person that's not this we want to do. And regardless the outcome, whether it's positive, we'll still provide services. It's negative, we'll still these are the services where we provide. So we dey use with counseling skills and we assure this person because that is part of the professionalism say that you're in a safe space. Whatever the happen here, it is staying here. I mean, we not there for judge you. People then they where they suffer in silence, then get STIs, and then they fear for talk because you know let them judge and say, this you sleep around or this not this. But here we just then ensure so we provide the service and not judge you. So whatever now the outcome, we will teach you and just know say your information is highly classified and confidential. They not they go beyond this consultation room or this treatment room where you sit up. And that we don't they be we approach and we form core of what we stand for. And over time, then they build the confidence and then they will continue for do because if confidentiality know the people lost you say we do kind of this place here information they out here and they not go come. So na make na something where we not a compromise at all. Even if there is any staff where we get an allegation or somebody come up say, I carry then this person is this, that staff they will be subjected to disciplinary action or even ask them out because I mean it just wants for the right people and people and you know behave professionally. So that is something where we not be compromise at all confidentiality.
Okay. So, in the year of outreach symposium and all, um, of course, now that una don reach out to Uni campus, and we see salon a country where STIs and boku teenage pregnancy boku, we want for know why not una extend them to secondary schools then, because then self get a lot where they go through in terms of all the sicknesses there.
Absolutely, and this very important. We they think about the population. You know, when you say public health, you not just think of one person. You look at the community. You look at the health of a whole population. Um, so this is now part of waiting we dey do, yeah.
Okay.
Just so that just probably a little over a week ago, we organized a gas conference, now Sumote for 3 days for commemorate menstrual hygiene, the global menstrual hygiene day. And what we do, we draw picking them across secondary schools, even some of them are with the university because then they don't be part of what we call the GAS Act, where AHF and other partners, Happy Kids, they support then get picking there so that then go get for know about the menses that if you're in the mess not to sick that means say you healthy and you therefore be proud of that one day we tell them about for abstain what we call for engage in early sex can predispose you to STIs. So this now some of the strategies they use and all then picking the other school picking and then at different schools and they serve as ambassadors and then serve they go, they engage the assemblies, then they move from one class to the other and send out that message there. And in fact, we also they use and say, okay, when you go out here and you get your peers, you get your community, you refer people them, talk to people if you get people them around, your family or in school where they go through whether belly heart, say they get discharged, vaginal discharge, or you get period discharge, or maybe they wet, they feel pain, or I mean the genital area they scratch, they put blister, so this kind of thing. Then they refer them people then they at the clinic. And now then strategies and they we use and we engage them on then different health related, comprehensive sexual health, how them for avoid risky sexual behavior and be role model. In fact, we get some among the way in the university now from secondary school and now they're only part of the IV. So it's a salient point, but just so that we don't engage the secondary schools them as well. We not just they go there physically, but we also they ensure say sustainability there. We develop talents them from within, we then will continue for educate them peers them.
So from the previous conversation, you mentioned say and treatment they are chemo free, and we get one concept in salon. Everything we get for the boku people them at times, especially for government hospitals, people can grumble say nurses they not can be polite, and now that this thing is free for everybody, we will not get any policy way for make sure say then people that way they go for follow up treatments then they know they mistreat them and see them say because they're free they will talk to them any kind of way.
Absolutely, we get very strong policies as an organization. In fact, the components they are one of the key components what we call quality improvement. In fact, right now we they do a survey, a feedback survey. Like we clients them where they come, we ask them for let them scan the QR code and let them give the feedback in terms of the waiting time, like where they come, how long they take, where we do tests and teach them. We they track all that one day. Because that one day very key. Somebody don't let something if I go class. Say okay, let's just go quick. Let's get tested and get me medicine at itself where I go take me class. You know whatever person go sit down for a whole hour and they wait. And then they lead to dissatisfaction and you know will come. Or somebody come begin they shout param, you know, and that's something where we know they condone. Yeah. And we from time to time you get feedback from the clients there because then they go also help with because sometimes you not go daily as the head or supervisor for see everything where they happen. But when you get a tool or a means for let the one the way they receive the services, they let them give feedback. Say, now so this service though, you know, in terms of accessibility, for access the clinic is very easy and often and difficult say for camp. The reception, they talk to me fine, they encourage me. I don't wait for long. Because all here they make let person feel satisfied and go out here and even propagate the message, amplify the message. Say, one clinic then at the regional hospital where they provide free services, not to just free but quality services. So yes, for answer your question, we get very strong policy and we they monitor, we they supervise for ensure say the services then reflect what we they say that we are providing quality services.
So as a clinic, how una can measure on a success and wetin on impact so far from when I start?
Yeah, so from where we start, um, we don't they provide services for the people of McKinney. As a matter of fact, we don't get some people them way they come out of McKinney. We don't get testimony because STI is on the increase, and we think say we don't neglect prevention strategy, and all too often people not want to talk about it because it's sex and the taboo, the culture, people can just be in silence and then they suffer. Why it matter for let we talk about STI, let we take concrete action and be intentional for address and the fact say it get a lot of complications. And one of the complications are that it leads to infertility, whether not from the man's side or the woman's side. You know, they make don't say where you want to get belly now because the infection, the STI don't chronic, it affects the uterus, the womb, the fallopian tubes then and it make it difficult for the woman they get belly. And sometimes even the only can get belly waiting they happen. The pikin no they come and can't sit down at the womb. You go then at the tube, a little what we call ectopic pregnancy. Waiting they lead to an person do emergency surgery for try to save that person in life. The man they kill it to urethral stitch or even infertility. You know, we get so many other complications the way they be as a result of STI. So we don't get the testimony. We don't teach people them way sometimes they don't sit down for 5 years, 6 years, and one forget speaking. But they don't come at the clinic, we don't teach them. And they say, doctor, I don't take, and they don't get belly where they progress very well in some or even almost born because we start this clinic inside June last year. So we don't equate the impacts in the way people then they come and say, then we don't they get this kind of belly heart or this kind of discharge where sometimes not even one person don't among people then because of the smell, then they don't improve or you don't cut off. So we don't get them kind of impacts then. In terms of the numbers, in terms of the people we don't target, we don't provide services for vulnerable people and disabled, the prison, commercial sex workers, the military, the police. And as it stands, we almost don't provide close to, I think a little over 2,500 clients then, where we don't see and provide free treatment for. So that is an achievement. That is an impact we are creating. We still want to do more. And I make with the target, now we say we want to target like 500 for see, at least we want to see 500 clients every month. And so you can understand how maybe from now to the time where this year go end, you go don't see up to then 7,000. So, and these are fee services. You know, if you go to a pharmacy or you go to a hospital where you go pay, whatever you tell them about, you don't spend 500 to 1 million, so you go down to them test and they, you know. So, these are some of the impacts that we don't create for help, at least we reduce the burden, the financial burden on people there, where no go get the money for accessing services and the other than go just be in silence and just continue for suffering in silence. Not because they don't want to go seek care, but not because they don't get the money for pay. So these are all impacts where the clinic don't create so far. And we look forward for create more positive impact in the health of the population of McKinney.
So with these free services and the number of population we una get any partnership, like partners from outside or maybe the Ministry of Health, we're able for resource the services there?
Absolutely. We work with partners then. We get people that we work with. Because now the health sector, the health system, you will know they work in silos. Yeah. For example, within the hospital, we get the family planning unit. And that unit there, we get another partner with our UNFPA, where they support that unit there. And so, all with cervical cancer screening, and that unit there, they do we they do referrals, we they work together. Yeah. We also they work closely with Rainbow within the hospital. Rainbow Initiative is another organization where then they focus on for provide care for rape survivors, sexual penetration survivor, and so any side way sex the possibility there for sexually transmitted infection there. So we they work with them so that you can see some cases and say this you need some kind of treatment, we can go in and treat, you know. And we say sometimes we will see a patient where from the history I get STI and they tell you, oh, somebody sexually abused me. Then we can also refer to the Rainbow so that you do counseling and do other interventions in terms of for support that person, that victim, because sometimes it can be traumatizing. So they rape somebody or sexually penetrate them against consent. Yeah. We also don't get, for example, condom support from Kia. You know, this is another organization because we also they provide, they distribute condoms at the hospital where person they come, whatever the outcome, we don't talk to you, we don't cancel, we talk about risky sexual behavior. For example, we talk about anal sex or oral sex, what are some of the risks and how really you for take you 10, let you not get some kind sick because now risky sexual behavior. And we also they provide condoms, free condoms, because we think say condom now one effective strategy that one they way to a very large extent they prevent most of the STIs there. So we they promote condom use amongst people them way sexually active because they prevent STIs and they also prevent unplanned pregnancy. You know. So and the Ministry of Health, of course, now the umbrella body that one day way gets the mandate, even the constitutional mandate for provide healthcare service for every Sierra Leone or every other person where within Sierra Leone. So then now the mama where also the support I mean the STI services then we provide in terms of even test kits and some other supplies. So yes, we not just the work in silos, we work collaboratively with them partners there, we work with community leaders, we work with educational institutions like Unimark, we don't go EBK, you know, we work with vocational institutes. So we work with people because that's now what we call public health. Now society for come together, everybody gets in part for play, for ensure say the communities then healthy.
So being that this symposium is already done, because not 2 days right, we they expect any other one for maybe Unimark and every other campuses now, I think.
Absolutely, you know, HF a moving thing, you know. Um, every other day where we grab, we want to impact the lives of people and communities. So even as I dey talk to Maya, we get for also work with EBK and get um, these departments, microbiology and immunology department. So I think today then gets them job itself where we also support them, provide some condoms and we give some health talk, health education. And tomorrow then get other program there where we get for the part of them for also do some screening, test for STI and treat if possible, and even for also get refer some clients then at the hospital for the cervical cancer screening and other services and where we not get able to provide at the outreach there because of the environment. But yes, we are set for tomorrow where we will work with the Microbiology and Immunology Department Association at the Anibakoma University where they get a health screening program. Well, then they into laboratory, so we then call them some program which is test me, I test you.
Okay.
And yes, so we are also working with them tomorrow. And for Unimark, like I say, this is not a one-off thing. We don't start. We engage and see how we go also cascade the screening to the Fatima campus now.
So this AHF clinic na Makini no in or in the another part of the country?
Yeah. So for the AHF wellness or for the AHF STI clinic, for now na Makini is there, but very soon plans then on the way for get another one a Fleeton. Yeah. But AHF, the primary or the mantra of AHF waiting AHF really don't they do or where AHF know of now also provide HIV care. You know, they provide care to people that where they live with HIV. And so in terms of then clinics and then plenty within a McKinney General Hospital, then Holy Spirit, Magwente, City Garden, Loreto, within about 8 to 9 health facilities and within McKinney. And HFD across the country in 9 districts, including Western area and Western area, rural and urban. We did Kabala, we did Bo, Kenema, Moyamba, Kailaum, within other districts then there. So HF gets a lot of clinics across the country, but I am mainly they provide care to people that really live with HIV. While the STI clinic, they focus on the general population, even the one that we not live with HIV. In fact, now the rationale behind that one because they think so if Boku STIs and they possible HIV and hepatitis no go there far behind. You know, so that make we want to be very proactive. So okay, let we raise awareness around prevention. If somebody has STI, let we teach them so that one day you know will come now and say this person don't get HIV, they don't get hepatitis.
So if I can draw you back to the cancer aspect, let's say una check somebody, una do test, and then find out that this person gets cancer. Let's say not even something just starting already don't get and so what I can do with them cases in there.
So if somebody don't already get cancer, we refer that person there to the doctor. We get them know how they. We get doctor they we call oncologist. There is a doctor they way they specialize for treat cancer sickness. And when it comes to woman that were body one, we get one main hospital in Afghanistan where we call the PCMH within a cottage. So they coordinate referral for that person. We communicate and say, okay, we get this patient now we suspect this. We refer let them go confirm if really it's cancer and waiting at the stage and waiting at the next line of treatment. Because for we now, as a clinic, we mainly dey focus on the prevention side. So now make we call the intervention as cervical cancer screening. Because where they screen, the aim na for let you pick up the sick as early as possible and prevent them. So now that's what they do. If they don't develop to cancer, we not dey treat, yeah. But together we dey refer to Freetown where we get doctor that we specialize in treating cancers. And that's what they do.
So now that the clinic just the McKinney, because there are other organizations that can start from the capital city, another big town there. So like why McKinney? Waiting at the trend where ignite the waiting self, the approach for making able for start an McKinney.
Yeah, so as an organization, we always believe in data. We look at the organization, look at we get what we call health demographic survey, where Salo can do. I think now the 2019 demographic and health survey, and it shows say within McKinney or Bombari, we get about 21 to 22% people then we do what we call self-reporting of STI symptoms then. What in this mean? They don't really test them, but when they do this survey, and then they go to each household and ask, okay, the last 6 months, you don't ever experience something like a discharge or you belly the heart or where you wet, you feel anything, yeah? So the survey shows say, where they ask people them about 21% to 22% say yes, within that past 6 months they experience then symptoms that are way related to STI. And that number there is just second to the number in the Western area. And we know Western area is highly populated, so that is expected. Then gets the highest number. But then second to the number, we get McKinney. So that one day we get for inform the organization that there is a gap here. This now we say now up county. Yes, McKinney is not a rural, it's a nice city, but then it's outside the capital city. Everything not just for be centered in Freetown, because now that we believe say we for even go to the farthest community, we even had to reach and also cater for them people and their health. So now that really inform that decision they now based on the data where we see and we look at them and realize say in fact this now the only second to the capital to the western area and where the western area way populated. So that tell you say there is something here and it can be more. It can be like because I'm not just by mouth, myself reported. So waiting with the TI for do now because we they do test and for that we also see okay if we don't provide then services there, yeah. Maybe after 1 year, 2 years, we can able to look at that data there and even try for generate waiting at the prevalence of even syphilis within McKinney because this now will be informed. So this not so by month again, this not test we test. We're able for tell we the gravity and that one they go further inform public health intervention. Say we need for intensify, we need for the community engagement, we need for enhance or intensify sensitization. We're able to look at waiting the data they tell we waiting at the age bracket of the people and where we get this syphilis so that we're able for target them. So in a way as we provide then services that we also want at the end of the day for us able for generate data we go inform government for take decision for even say maybe we need for incorporate STI services with even HIV services across the country so that we roll them out across the country. So now that's not the basis.
So as we try for end, waiting on like you are the head, the regional officer. So waiting at the commitment we will give people them as to this outreach symposium and then the screening and treatment and all.
Yeah, so the commitment now that we there we did at the McKinney General Hospital, and the AHF Wellness Clinic are part of the McKinney Regional Hospital. We they provide them free services there. As long as they need the gap there, that people they come and they access the services there. This na a service where we dey sustain and possibly even expand, because that is very key. You know, if you dey see the figures, you dey see the data that more people than they access this service. In fact, we dey pick more cases there. Now they go now able for inform we say, in fact, we need to establish more of them clinics there, not to just McKinney. Maybe we need to think of Magboka, or even within McKinney, we need for also go to some other hospitals. So that is the assurance that we will continue with them services there, and we will continue for engage young people, we will continue for engage institutions, community leaders, religious leaders, the local authority, for amplify the message around STI, around responsible sexual practices, because that one day they promote the prevention side, and the one that we already get infected, then we teach them and also ensure say then get the correct information how to prevent themselves moving forward, so they not will get reinfected.
So lastly, written a word of encouragement to people that out there with afraid for going to clinic, to institutions, to students, them, parents, them as well. So written you encouragement to them for make them not afraid, for make them calm, and how best able to encourage them for make them take be part of a clinic.
Yeah, so to the people them out here, and want to talk to everybody that you help and you right, and now the responsibility of everybody for protect, for guard your health, and how you go do that one day for improve on health seeking behavior. If you get the red flags, then you will get some symptoms, not ignore your body, because all too often, most times waiting where things can happen, we can just say, this person, this just happened to her normal. But the signs then can they let we not ignore them. Let we come na the McKinney Wellness Clinic where they na McKinney General Hospital na Makama. The clinic very accessible. We operate from Mondays to Fridays from 8 a.m. to 5 p.m. from Mondays to Fridays, and even on Saturdays for all the appointment the way we will get, because some people then not can get time during Mondays to Fridays. Sometimes they work too busy or so, they can only able for come during the weekend. We still available for provide the services, and the services we get a space where a safe space. We maintain high level of confidentiality. A space where na stigma free. We not the judge. We not the discriminate. So I talk to family out here and I let them not afraid. Let them feel free. Let we try to develop that culture where we discuss issues around sex and the health implication of sex, because we can make them as taboo. We not want for discuss them. Let we normalize them. You get your partner. Let we normalize sex, healthy sex conversation. You ask your partner, when last you do your test, you know. Let we get that bit where, okay, every 3 months or maximum 6 months, let we just go do a screening and know which status. So I'd encourage all family out here that the services are free. Let them come to the clinic and access the services there at no cost. At no cost, absolutely. And the other stakeholders that behind that, it's not just about the McKinney General Hospital or the HF Wellness Clinic. We all get a responsibility. Let we pass the information to the communities then that this service did and are available. Of course, we get a clinic number where somebody can also call in case the direction why don't you know probably not too clear, person can also call. We get the clinic number where I know with the permission I just
Yes.
read the clinic number where somebody can call for book appointment. So the wellness clinic number na 076 793338. 076 793338. So this now the clinic number where somebody can dial and reach me out. It's okay. So tell I want come for can get service, then we go book them, say I would expect these clients for come this so that we go prepare for them as they come. We provide service for them quickly to return and go about in business. But I want for assure Fambul and Oxianda that we dey provide client-centered, confidential, stigma-free, and quality services at the McKinney General Hospital Wellness Clinic. Let them not afraid, let them come. The information will be kept confidential and then we'll receive quality services.
All right. Thank you very, very much for your time as you don't take time for explain Giwi and Fambul everything we need from you. Thank you very much.
Thank you very much. I'm glad for the activity. Thank you for the opportunity.
And plenty thank you to we viewers them as soon as don't stay with we. We want for tell una plenty thank you for we this the regional head don't take it time for explain you what we need for know about the symposium, the screening and the treatment we happen at Ionic campus and the opportunities them at the entire McKinney. We want for tell una thank you. Well body business na everybody business. And again, we want to tell thank you to the producer of this this evening show, when Mr. Shebra Samba Kamara. We want to tell thank you to the technical operators, when Samuel Bangura, Robert Koroma, and Eddie Benzo. Again, we want to tell thank you to the camera operator, when Mr. Abu Conte, and then to the graphic designer, Amidou Kalon. We want to tell you thank you. And lastly, we want to tell thank you to the executive producer, when Mr. Matthew Abdulkanu. Again, we want to tell you thank you. We don't take your time for listening to me. Me, again, on a presenter, Mabinti Samura Bant. Until we meet again, thank you. Tata.
Yeah. Unimac to the world, though. One line TV, now we voice, now we story, oh. Robert, you too good,